It's time for episode 84 of The Crisis Show here on Google Hangouts, on YouTube, and wherever else you have this link around the world. Good evening from New York. My name is Rich Klein. I'm president of Rich Klein Crisis Management and founder and host of The Crisis Show. Tonight, I want to look at Texas Health Presbyterian Hospital, which is a great example right now of an organization that was unprepared for the Ebola crisis and maybe some other things we don't know about, but certainly they were unprepared in terms of their protocol, in terms of the way they trained the medical staff in how to care for Mr. Duncan, the gentleman who died earlier this month at that hospital. And today we learned from a national nurses union that some of the nurses at Texas Health Presbyterian have come forward anonymously to tell their story. And what they're saying is that the hospital was constantly changing its protocol for caring for this patient, Mr. Duncan. In addition, there were mistakes made. For instance, he wasn't isolated and things were not done by the book in terms of removing waste and so forth to protect the rest of the public, particularly the hospital population. So we also learned today that the 26-year-old nurse who treated Mr. Duncan, who's tested positive for Ebola, she is now being transferred to Emory University, Atlanta, to be treated. The lesson here, folks, is that long before a crisis hits, you need to make sure you have thought about the wide variety of crisis situations that could hit your organization very quickly. And then you need to make sure that you have a plan to respond to those crisis situations. And then C, you need to make sure that you can communicate effectively to the public about that crisis situation. So in another interesting development today around this crisis, the U.S. Centers for Medicare and Medicaid Services now says that it's reviewing these allegations made by the nurses around these reported improper procedures and these quote-unquote constantly changing safety guidelines. Daniel Varga, the chief clinical officer for the hospital's parent company, which is Texas Health Resources, participated in a news conference this morning, and he defended the hospital's ability to contain Ebola, according to this report I'm reading. And he says, "I don't think we have a systematic institutional problem." Now, when you're in a serious crisis and you get defensive like that and don't acknowledge the issue, you're going to open yourself up to more criticism. I didn't see the press conference. I'm reading these reports, but if I was advising this parent company of the hospital, I would have made sure that there was some acknowledgement of a problem. And listen, people are going to be forgiving to a point because Ebola is new to this country in the sense of there hasn't been this kind of crisis in this country around Ebola. And he could get off the hook just a little bit by saying, yes, we did have some problems. This was fast-moving information, and we did the best we could. But now that we have more information and we have more help from the CDC, we're going to do a better job, and we apologize for any mistakes that were made. We're going to get this right and become a better institution. Those are the kinds of things that you'd want to hear when the media and some of your own employees and the federal government is now at your doorstep, is now putting a light under your operation. So you need to, when a crisis hits and there is some fault, the best way to protect your reputation when you know there's some fault is to acknowledge that and to let people know you are working to improve it and that it won't happen again, or that you're going to do everything you can to prevent it from happening again. Another lesson here regarding Ebola and Texas Health Presbyterian is that sometimes crisis events that happen elsewhere can soon land on your doorstep as well. Case in point, Cleveland International Airport and Frontier Airlines. On Monday, one of the nurses who has now been diagnosed positive with Ebola, Amber Vinson, she was visiting relatives in Akron, Ohio, and she returned on Monday on a Frontier Airlines flight from Cleveland to Dallas. And now, because of that, Frontier Airlines and the airport find themselves in crisis mode. Frontier Airlines has to shoot down rumors about passengers being asked to use surgical masks. They have to deal with the media asking questions about the cleanliness of and sterilization of the aircraft that's now that's been put back into use. They had to explain that they cleaned I think it's being reported, they cleaned the plane in question about 3 times. And Cleveland International Airport has announced that it's going beyond CDC guidelines and sterilizing all the areas they believe Miss Vinson was in when she was in that airport earlier this week. So a great example of how somebody else's crisis can become yours as well, even if it's on a smaller scale. So the lesson again is, when you're going back to what I talked about earlier, when you're in a room with your leadership and your executives planning for all these different crisis situations, you also must think about, to the best you can, you must think about these what-if scenarios and crises that may not seem obvious at first. They may not seem obvious that they could land on your doorstep, but in this case, it's clear that the incidents at Texas Health Presbyterian have enveloped Frontier Airlines and Cleveland Airport, as well as other organizations, I'm sure. These are the 2 that are in the news today. So if you have any thoughts about what you've seen from this video, please use hashtag #TheCrisisShow. Let us know your thoughts. Again, this is Rich Klein from New York of Rich Klein Crisis Management. Thank you so much for watching. We'll see you soon.